Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we'll further explore multiple choice questions related to our previous topic, techniques for open extraction of multi-rooted teeth. We will go over additional MCQs related to extraction of mandibular molar with the missing crown and explain the key concepts and content from which these questions were derived. If the crown of the mandibular molar has been lost, the procedure again begins with the reflection of an envelope, a flap, and removal of a small amount of crystal bone. The burr is used to section the roots into the mesial and distal components. Remember that we are discussing the extraction of mandibular molar with missing crown. So the question is, what is the initial step in the procedure of a mandibular molar with a lost crown? So let's discuss the option. This step comes later in the procedure. This is the correct answer. This is the initial step to expose the surgical site as seen in this figure. When the crown of the lower molar is lost because of fracture or caries, the envelope flap is reflected and a small amount of the crystal bone is removed. Used after root sectioning, this step is not initially performed. This is performed after the envelope flap is reflected. So the correct answer is B. The initial step is the reflection of an envelope flap to access the surgical area. The burr is used to section the two roots of mandibular molar with missing crown into mesial and distal components. What is the purpose of using the burr in this procedure? This is done with a different tool. This is not the direct purpose of the burr in this context. This is the correct answer. The burr is used to divide the roots into mesial and distal components. As in this figure, a burr is being used to section the tooth into two individual roots. This is done using elevators. This can be done, but not the main purpose described here. So the correct answer is C. The burr is specifically used to section the roots into mesial and distal components. The roots of the mandibular molar with missing crown is luxated and mobilized before removal. Which instrument is used to mobilize and luxate the roots in this procedure? Used for sectioning roots, used after the roots are mobilized, not specified for this step, specifically mentioned for mobilizing and luxating the roots. A general term that does not specify the small size required here. So the correct answer is D. The small straight elevator is the instrument used to mobilize and luxate the roots. The Kair elevator is rotated to deliver the distal root occlusally from the tooth socket. Which technique is used with the Kair elevator to deliver the distal root? Not specified in this procedure, not a described technique. The tip of the elevator is placed into the slot prepared by the burr, and the elevator is turned in a wheel and axle manner to deliver the root. This is irrelevant, not the technique used here. So the correct answer is C. The crier elevator is rotated in a wheel and axle manner to deliver the distal root occlusally. The instrument is engaged in the empty root socket and rotated through the interradicular bone to engage and deliver the remaining root. How is the remaining root delivered after the distal root has been removed? Not described for this step. Used for initial root. This is the correct. Specifically mentioned for the remaining root. This figure shows that the opposite member of the paired crier elevator is used to deliver the remaining tooth root with the same type of rotational movement. Sectioning is done initially, not relevant to root removal. So the correct answer is C. The remaining root is delivered by inserting the opposite cryer elevator and rotating it through the interreticular bone. Let's explain the key concepts and content from which these MCQs were derived. When the crown of mandibular molar has been lost, the procedure begins with the reflection of an enveloped flap and the removal of a small amount of crystal bone. This step is crucial to expose the surgical area and facilitate access to the roots of the molar. The bar is used to section the two roots into mesial and distal components. Sectioning the roots helps in separating them, making it easier to extract each root individually without damaging the surrounding bone. This image is the representation of the initial steps, including the flap reflection and crystal bone removal. Bar is used to section the roots into mesial and distal components. The small straight elevator is used to mobilize and luxate the distal root, which is delivered from its socket by inserting the cryer elevator into the slot prepared by the dental burr. Mobilizing the distal root is a preparatory step for its removal. The cryer elevator is effective in engaging and luxating the root. This figure shows the cryer elevator is used to elevate the distal root. The tip of the elevator is placed into the slot prepared by the burr, and the elevator is turned to deliver the root. The cryer elevator is rotated in a wheel and axial manner, and the distal root is delivered occlusally from the socket. The wheel and axial rotation provides leverage, making it easier to lift the root out of the socket without causing unnecessary drama. The image shows a cryer elevator rotation technique. The opposite member of the paired cryer instrument is inserted into the empty socket and rotated through the interreticular bone to engage and deliver the remaining root. Using the paired cryer instrument allows for effective engagement and removal of the remaining root by utilizing the interreticular bone for leverage. This figure shows the opposite cryer elevator engaging the remaining root to deliver it with the same type of rotational movement as described earlier. By systematically using the cryer elevators, both roots of the mandibular molar can be effectively removed. Even if the crown is missing, the cryer elevators used in sequence ensure that both the mesial and distal roots are extracted without excessive force or damage to the surrounding bone structure. Thank you. Wish you best of luck.